Welcome back to the BAMF Health podcast. The primary focus of the BAMF Health podcast is introducing you to the people and the organizations that are advancing personalized healthcare. Now, personalized healthcare is a two-way street. It's the responsibility of a patient and the provider. And so that's what we're going to talk about today. And with me, I have our guest, Dr. Jeremiah Johns, who's the VP of Medical Affairs at BAMF Health. And we also have Dr. Simin Beg, who is the Chief of Hospice and Palliative Care at Corewell Health. So thank you both of you for being here.
It's delightful to be here.
So, okay, the cool thing about both of you that I found out in talking to both of you about this podcast is that you are not strangers. You have a history that goes way back. So let's start with, tell us about how you two know each other and kind of that story.
Well, we kind of met in dire circumstances. We were both interns at the Butterworth ICU 23 years ago, should I even say that?
Wow.
I don't think much has changed, though. I think we both are the same, maybe a little wiser.
Yeah, it's hard to believe it's been that long. It doesn't feel like that long.
No.
I don't think I've changed.
No, you haven't. I will vouch for that. Not even a bit.
So both of you are physicians and got your start in that world, in the ICU then.
Yeah. And, even though our careers have taken very different paths, I think and as I was reflecting on this, I remember us both being very concerned and intentional about the human aspect of medical care, even back then. And I think that's probably stayed throughout our careers and where we are now.
Mm-hmm.
Yeah, definitely. And when you're an intern, you're kind of thrown together on these teams and you're in the hospital for very long periods of time, just working together. And you definitely develop a different kind of a bond through that.
Right. Yeah. I can imagine. Okay, so now you've had 23 years under your belts in your careers. So Jeremiah, let's start with you. Tell us a little bit about your role and responsibilities at BAMF.
Okay. So I started out where we met. I was doing my ER residency and practiced emergency medicine here in Grand Rapids for almost 20 years. Before I joined BAMF, and during that time I got into health informatics, but joined BAMF where we're working to accelerate access to precision medicine. So as VP of Medical Affairs, I lead the clinical teams at BAMF, which involves our therapy clinic for oncology patients and Alzheimer's patients, and our molecular imaging clinic where we do advanced PET scans, PET CT, PET MR, and regular CT and MRI scans.
And Dr. Beg, how about you? Tell us about your role.
Yeah, my career took a different turn. I am a division chief of Hospice and Palliative Care. And in my clinical role, I'm responsible for helping clinicians navigate complex communication, symptom management, and then helping with the decision-making around serious illness. In my leadership role, I'm a part of a team that helps create systems that support compassionate, patient-centered care, evidence-based care throughout the whole organization, not just at the bedside. And what I would say is that this work is so meaningful because it really sits at that intersection between evidence-based clinical care, high-quality care, and the human aspect of taking care of patients. And it's what I find the most meaningful about the work that I do.
Yeah, that's great. So at the beginning, I sort of introduced our discussion for today, the idea of personalized care being a two-way street. Now, we talk a lot at BAMF about the services and the treatments and the imaging that we provide that are very personalized and precise. But there's also this aspect on the patient side where a patient has a responsibility when it comes to personalizing their own health. So talk to us about that two-way street and the responsibility between provider and patient.
Healthcare is a team sport. And it will not work well unless we work together. And when I mean work together, I mean the clinicians, all of the clinicians, the healthcare system, with the patients and their families and their support systems. So that personalized care has to be a two-way street. And it really starts with the healthcare team being compassionate, but honest about what is going on. Sometimes we don't want to share the news because it's not always great news.
It's hard.
It is very hard. And then from the patient side, for them to process that, for them to really absorb that information, and then be courageous to talk about what matters to them. And then together, the next steps, are decided, what makes the most sense. So you can see that it's very much a collaboration between the patient's families and the healthcare team.
Jeremiah, I feel like at BAMF Health, this is something we do really well, sort of the personalizing care on the provider side. And I think our patients are involved as well. So what does that look like at BAMF? How do we help our providers help patients in personalizing their care?
Mm-hmm. So we're doing a lot of things to try to personalize care. And one of the main things that we're trying to do is innovate and make the diagnoses and the treatments more precise, more accurate, so that the treatment is tailored to the individual person rather than a one-size-fits-all treatment. And what that translates to is our patients frequently have, metastatic cancer that's spread. Maybe all the prior options have been exhausted. So we do the standard of care treatments, but also a lot of clinical trials. For our Alzheimer's patients, they're being treated now with some new drugs. They're in the early phase, but this always translates to when those things also aren't going to help anymore. And so we have to have a lot of those same discussions with our patients who really are facing these very difficult problems.
Mm-hmm. Complicated. I really admire all the work that you do. I follow along with what BAMF is doing, really remarkable work. But to your point, sometimes it just doesn't work.
Mm-hmm. Yep. Yeah, there's this interesting dynamic between personalizing care in the sense of the medicine and what is biologically right for a particular patient. And then there's what you want out of life and what makes the most sense for you where you're at. So how do you balance those sorts of things?
I think that there are different layers of personalized care. One layer BAMF does exceptionally well, really looking at what medications are going to be most effective for a person's genetic makeup. Very, very important to do. But Jeremiah, to your point, that there does come a time, and I'm going to say something that maybe people don't want to hear, but we're mortal. There is going to be a time where no matter how precise the treatment or diagnostics are, humans will be in end of life. And that's a very important thing to acknowledge. It's hard, but it's very important because it's true for everyone. Mm-hmm. So when we talk about personalized care, that second layer of personalized care is really making sure that the healthcare team understands what's important to the patient. What do they believe? What are their values? What are their preferences? What kinds of values should be guiding the next treatment plans? And where do they want to spend their last weeks, months, maybe even years? And that's very personal. What's important to me may not be to you, right? But we can respect that for each other. And that, I think, sometimes gets overlooked a little bit. But that's equally important, I would say.
Yeah, it can really come down to a lot of personal decisions. So, for example, BAMF Health we're almost 4 years old, not quite. But in 2025, we treated patients from 26 different states. So those patients wanted to come to try to get the best imaging or the most advanced technologies. But also, a lot of patients really don't want to travel outside of their local community. And that's why it is very important, as the health systems and Corewell Health really do a lot to try to be able to keep really excellent, high quality care local so that people can make those personal choices for themselves, because it really can become more than just the treatment, but also the travel, being away from family, and different things. And some people, they want to do that, but other people choose not to.
Yeah.
And I think this brings up a good segue here into the health literacy of people, because you could say, yeah, as a patient, you have the ability to choose where you get a scan. You have the ability to choose where you get treatment. You have the ability to choose what treatment you receive. And yet there has to be a level of health literacy in that. Dr. Beg, tell us about health literacy in the population right now and sort of the challenge there.
This is just astonishing to me because 12% of the adult population in our country has adequate health literacy. That is extremely low. And what we mean by health literacy is not being able to read and write, the medical things. It's about accessing, obtaining, understanding, and then utilizing healthcare information for personalized care. And you can see that's complicated. I have had encounters with the healthcare system. Both my parents passed away here, and it was hard. I'm a physician. This is the work that I do, and it was still very hard. So people who don't have quite the resources that we have the privilege of having, their health literacy is it's just inadequate. And without that, they cannot make informed decisions. And the poor health literacy is not a deficiency on the patient's part. No. It is really a systemic issue. It is the responsibility of healthcare systems to make sure that patients are able to, again, access, obtain, understand, and utilize their health information. It takes time, and I think that's the one thing that we skip over. I think a lot of clinicians have been really good at understanding or trying to understand what's important to patients, but sometimes health literacy takes a long time, and sometimes we may say we don't have the time to do that, but it is a critical part of informed decision making, and I would even say it is our patients' right, and it is our responsibility.
Do you feel like it's also on the providers too? And I'm sure a lot of providers do this well, but maybe some providers come into discussions with patients and they're throwing around jargon and medical words and they're talking really fast and they just spit it out. And that is a hindrance to a patient in trying to understand and have some level of health literacy, because they don't understand what was said. I think Dr. Mancini does a fantastic job with that.
Yeah, I think really being empathetic and taking the time to do the things that are necessary to help the patients feel comfortable about the choices that they're making is extremely important. At the same time, there are just a lot of complex problems that tend to get in our way of that. And that's why it's great to have you being that advocate out there for that. And it's definitely something that we promote at BAMF Health. And, even as a physician, I've had family members with complex medical problems, and I've been able to navigate different things and apply 20 years of medical knowledge to it, and it's still challenging. And so we really do have to work constantly to try to lower that friction for patients.
Let's take an example to sort of illustrate this. So you mentioned one of the services and things that we do at BAMF is our Alzheimer's program. So the consultations, the imaging, and the treatment for Alzheimer's. What does personalized healthcare, having that two-way street between provider and patient to get personalized care, look like in the context of Alzheimer's?
So at BAMF Health, we evaluate patients and treat them for what's called mild cognitive impairment due to Alzheimer's disease. It's a mouthful.
It is.
So Alzheimer's, unfortunately, is a continuum, right, where it starts early and mild and gets worse and worse over time, and unfortunately affects so many people. And there's really been very little that could be done about it until now. There are two new medications which are FDA approved to treat it that results in a 30% slowing of the progression. So it doesn't reverse it. It doesn't cure it, but it slows the progression, which can be very meaningful for people. And so this really is precision medicine. It involves dedicated neurologic examination of the patient, understanding what their life and social living situation is, what symptoms they're having, their medical genetics testing, advanced PET scan imaging to look for the amyloid plaques in the brain. And then we treat with a specific drug called a monoclonal antibody that treats it. So it's a complex process, and you have to qualify, meaning it can't be too severe.
Mm-hmm.
So
early Alzheimer's.
It has to be early. And then once you go on the treatments, though, you'll need follow-up MRIs. You'll have to come in for monthly or bi-weekly infusions. So that becomes a personal decision for families as well. How far do they have to travel to get it? How often do they have to, arrange transportation? And these people are struggling with memory. So it's very challenging still.
Yeah. In your line of work, talk to us about Alzheimer's disease and sort of the personal choices, personalized health decisions that need to be made.
Well, Jeremiah, as you said, that this is a progressive disease, right? I think you're right that 30% slowing of progression is so meaningful and impactful. But the end result, at whatever point that is still that patients will not survive Alzheimer's disease. Yeah. So what's really important is, alongside them getting the treatments and all of these really specific and precise interventions, which again are just wonderful that we even have that in our community, it's also important for patients to know that at some point these precise interventions won't work. And this is not about taking away hope. Again, it's very much about being realistic so that patients can decide. And in these situations, educating patients and families, kind of the signs of when those things are no longer working and what would matter to them. So in these situations, robust advanced care planning, when done appropriately, is really the most effective way of precision medicine. It does take conversations. And what I find with my patients with Alzheimer's, having palliative care alongside, maybe their involvement in the beginning is less, but as the disease progresses, or maybe there's more symptoms, they become more involved. But having them alongside really helps the patients and families, because oftentimes people don't know what they're going to decide in those situations, right? You might, a patient might say, oh, I want A, B, or C. But when it comes down to A, B, or C, they're saying, this is not what I thought it was going to be. So just having that personalized approach, that advanced care planning, which is an ongoing conversation, really, I think, partners well with the precision medicine of BAMF.
Oh, it's so important. And the good thing about it is these are the kind of the first drugs that are available.
Yeah.
But the science is progressing, and I know that it's going to get better and better. And whether you're talking about Alzheimer's or cancer care or cardiovascular care, so it's a constant evolution.
Yeah.
But you really do need that advocate to help you through the decision-making process.
And you've got to be willing to, as a provider and a patient, understand that there are points throughout a treatment journey where maybe you pause and you reassess. Yeah. Now, some treatment cycles or treatment journeys have to proceed for various reasons, but is part of the personalization taking the time at some point to stop and say, what's working, what's not, how are you feeling?
Exactly. And again, it is a journey, and nobody really knows what that journey is going to be. We kind of have ideas. We're experts in the medical field, but it's just really hard to know what the patient's emotional state, psychological, spiritual, those kinds of things, even physically, how they respond to those treatments, and what the trade-offs they're willing to make are. That can change. So having that ongoing dialogue and having that ongoing symptom management, that interdisciplinary team supporting the patient as they're getting these really wonderful and effective treatments really does treat the whole person. And that's, I think, the ultimate goal of healthcare.
I think at BAMF, we probably have these conversations with patients who maybe they've gone through the whole journey with Pluvicto, for instance, and maybe their disease progresses, and then you have a decision to make. Are you willing to try a clinical trial? Are there additional standard care options? And everyone sort of has to be honest about that, right?
Exactly. Yep. And some people, they've gone through a lot. The new radiopharmaceutical therapies that are available are pretty well tolerated, and but maybe other options might have a lot more side effects. Even when you enter a clinical trial, that's a very personal choice as well. We have a lot of clinical trials that are maybe for new imaging agents to help, better diagnose breast cancer or colorectal cancer or something like that, where our patients actually know, I'm not going to get any benefit out of this. But a lot of them, they're doing it because they want to help the next patients. So it's a continuum.
Yeah.
Do you see that as well? Sort of the ability to further medicine is sort of a motivator for doing one thing or another.
Yeah. Again, that comes down to the patient's values, right? As I teach students, residents, and even my teammates, when we are listening to what a patient values, we must do so with a absolutely non-judgmental viewpoint, because we can't argue somebody's values. And so really hearing what patients are saying is, this is what I value, and then be realistic about it, right? Sometimes patients might want something that is not realistic, and it is our responsibility to be honest about that. But when they're expressing a value, which maybe I want to further, this medical research, that's your value. Let us help you. Let us help you get there. And even if I might say, I wouldn't want to do that, it's not about me. It's about hearing what my patient values, what their preferences are, what they think is important, what gives their life meaning, and then taking that and partnering with them for the next steps.
Let's dive for a minute into that end of life care and talk about the options that exist and the ways in which patients can sort of decide how they want to approach that. Because again, at the end of the day, you have control as a patient. Whatever a physician or provider or institution tells you you have to do, there's always an option. You always have the choice. So how does that work in your practice?
Again, when we align care with what matters most to the patient, sometimes that care means focusing on comfort. Sometimes patients will say, I may get better from A, B, or C disease, but I don't want to be in the hospital. I don't want to find transportation. I don't want to do my weekly visits. I want to spend time with my family and loved ones, even if it's less time. Sometimes I see patients making that choice quite frequently. And what I also find is that the majority of patients, about 80% of patients, want to die in their home. They want to spend their end-of-life days in their home, but only about 20% do. And so our job, as just not in hospice and palliative care, but I think as healthcare providers, is to really understand when patients are making that decision and why, and then helping them do so. End-of-life care, I tell my patients that the end of life is going to come with or without hospice care. Hospice is about helping you live well all the way to the end. And you get to decide what that means to be living well. Right. And so that's the philosophy of our end of life care, that, our job is to use our interdisciplinary team and really focus on what gives a patient the maximum quality of life as they define it. So that they can live well to their very last breath.
I've had a lot of experience from my work in the ER where some of these decisions kind of get forced on you, and you don't have the opportunity to think about it ahead of your upcoming appointment. And one of the biggest things that I've seen is people really, whether it's family members or the patients themselves, struggle to think, am I going to make the wrong decision? And so I've really felt it's been helpful to let people know there's not a wrong decision on this. And you really, when you can give them like permission to follow their instincts and not agonize over maybe I made the wrong choice, especially on something that's, so final. And I think that's been really impactful in the past.
And my guess is that that's a discussion at any point in your disease journey, whether you're right at the beginning or whether you're at the end. There sort of is no right or wrong. There is what is standard and there is what is recommended. But I love that. That's important. And is that something that you guys talk about a lot?
I do. I just love that. Is such a patient-centric way to practice medicine. And I do remember that about you even as an intern. So that's not a surprising thing there. But that's exactly it. This is a scary time, and patients do need reassurance from time to time that it is okay. If this is what matters to you, it is okay to choose this. That is not a wrong choice. What matters is you having the autonomy and you being the driver of your healthcare. That's what we want. And you get to decide that. There is no wrong decision, and we're going to support you in that. Not always easy to do. I think some people do it better than others, and but that is just that makes me feel really glad that we have clinicians who practice that way, because that's really important.
Yeah. As much as we talk about precision medicine and the ability to go deep into someone's molecular level and say, this is what you should do, and this is what the process that you should take, the path you should take because of your biology and your molecular makeup. At the end of the day, you as a patient have a choice. And it's wonderful that we have both those options, both the precise recommendations based on your biology, and we have the how you want to live your life. And it's important to have both.
Well, really, you when you're making those decisions, you want better information. Yeah. And that's what's exciting about what we're doing is we are working to push the envelope to get better information so we can make the right decisions about the right treatments that are going to have the best chance of working and what the outcomes are going to be.
Yeah. You're not guessing as much anymore because we are getting more precise.
It's just really remarkable to have that in our community. Yeah.
Well, this has been great. I really appreciate you both coming and sharing your insights, talking about what in some cases is a difficult topic, difficult for people to discuss. So I appreciate that. And thank you for your time.
Thank you.
It was just really wonderful to be here.
Wonderful. All right. Well, we'll see you next time.
You as well.